All right, the webinar is now live and folks are logging on.
Father, I did watch your YouTube video. We did open the email. Very nice. And I do plan on finding a cross for you too, real soon here, sir.
Thank
so
you.
That was my proof that I actually did open it and watch it. So
Thank you. Thank
I didn't want to be on the naughty list.
And John, I read all your emails too, just so you know.
Well, it's not a personal thing. I just want the parents have to be informed. We have really no other way of doing it.
I know there's something that we're all experiencing that we've lost, and sometimes those parent meetings that we have, a lot of information is shared after in dialogue and in nuance that we just can't do in email. All right, so we have 140 folks on the call now. That's still going up a bit, so we'll take one more moment to let the participant numbers rise, and then we'll get started.
We're competing with the vice presidential debate, of course.
Mine is set to record.
All right, so welcome to our second of 2 parent and family webinars to talk about the framework for our return in the second quarter. Before we get started, I would like to invite Father McGarry to lead us in prayer as we do with all things at Jesuit High School. So welcome, Father McGarry.
Thank you, Dr. Wood. Good evening, everyone who has joined us. 152 people so far, parents, dear parents. Nice to be with you. I can't see you. We cannot see you, but we know you're there, and we're grateful for your presence this evening as we talk about our safe return to campus starting next week with the orientations. We are very excited to welcome the students and the faculty and staff back to the campus. I do want to say a word before we pray, a word of thanks to Dr. Wood and his administrative team, Assistant Principal Fadia Desmond, Assistant Principal Rod Theodule, Assistant Principal Colin O'Connor, and many others, our Director of Marketing Communications who's here, who have been working very hard to prepare this safe return, and many other people have joined them in this effort. We've been working on it all summer and into the fall here. So thank you very much for trusting what we are trying to do and reading our weekly messages so that you understand what we are trying to do. I also want to thank the doctors from Urgent Care Now and Immunify who are with us this evening. I know Dr. Wood will introduce them more thoroughly, or they'll introduce themselves, but I've been impressed by their passion for helping Jesuit High School. Of course, Dr. Oshida has a son here, but I've been moved by the level of detail of their research and their clinical work and everything that they are bringing to this testing program that we are providing for our safe return. So thank you very much to Dr. Williams and Dr. Oshida. And they have a couple of more colleagues involved in this who are not with us this evening. So thank you, parents, for being in partnership with us and being here tonight. We hope you will find this helpful. I'd like to begin with a prayer called the Dedication of Studies. It's written by a Jesuit by the name of John Twist. And it's a prayer that we would begin each school year with. Of course, we're at the end of the first quarter, but I still think that it applies. So let us pray in the name of the Father, and of the Son, and of the Holy Spirit. God, our Almighty, to you we dedicate our studies, our students, the studies that we engage in as adults, as parents, research and thought, discernment, prayer, reflection, and reading. And we dedicate to you the work of our school this year. Open our minds and our hearts so that together we may be grateful for our gifts and the gifts of others, generous to become men and women for others, attentive and discerning in the events of daily life, compassionate with the needy, loving toward other people, faith-filled in our beliefs with hope in the future, eloquent and truthful in our speech, learning to find God in all things and in all people. Let us be curious to know, engaged with the world, committed to change for the better, for the common good. May we use the resources of the earth prudently and set a prophetic example by our conduct so that we may exemplify, so that we may employ our knowledge to benefit others and create one family of all nations and all peoples to the greater glory of God. May Mary, the mother of your Son, Jesus, and our mother, assist us in all that we do every day and make us more like Jesus, her Son, our Lord, Jesus Christ, now and forever. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Thank you very much.
Thank you, Father McGarry. As I mentioned at the start, the purpose for tonight is to allow us to talk through the framework of our second quarter plan where we get to return to campus. And one of the purposes for this presentation, or this I'd call it a conversation, but as Father McGarry said, we can't actually see you. But one of the purposes is to keep soliciting the questions and concerns that you may have that we can address in future correspondence, specifically the next Friday correspondence being a major one. So as you ask questions as we go through tonight in the question and answer option on this webinar, we'll do our best, especially with Dr. Desmond and Dean Theodule, to respond in writing to some of those questions as they can. But we know from our experience, we'll get hundreds of questions that we can't answer all of them, and that's okay. We'll make sure that we categorize and then answer those questions either within the next correspondence or what we have as a growing frequently asked questions sheet. So you might leave this having your question not answered. That's going to happen a lot, but we do know that we are taking those questions and recording them and making sure that we answer them in our next communication. It's also important to note that some of the information that we share is assuming that you've read our previous Staying Connected messages. A lot of the information in there with schedule and framework has been written to you already. And if you haven't read that yet, that might be difficult. And you may do so right now by going to our website. You can follow along and looking at some of our latest messaging from the press room part of the website. That might be helpful for folks as well. So to start, I would like to talk about how we got here, a little bit of context. And the best way to start is that a few things happened towards the end of the first quarter where we were in full distance learning that required that we make some adjustments and change for the second quarter. One of those things was the parent, student, and teacher surveys that we gave on their experience of learning and distance learning in the first quarter. And we had lots of great feedback from many participants in those surveys. We appreciate that feedback. We also had at the same time the possibility for a return to campus or a partial return to campus with the state of COVID-19 in our county and opened up that pathway. So both of those things were happening simultaneously. So we had to shift and adjust to that plan. We also know that we learned a lot since the original Safe Return Plan was put together. And we also got to watch other schools attempt reopenings, some successfully and some not successfully. So we used a lot of information, a lot of experience that we could find in what's happening and the feedback from many of you to update what we were going to do in the second quarter, especially with the context of a return. So the first thing we looked at was the academic framework working? And in many ways it was. There was lots of good things to the academic framework. The structure was working. Google Classroom seemed to be a really helpful tool that was being used even better than it had in the past. The Zoom dashboard and the upgraded Zoom technology is working. So there's lots of good things that came out of that. but it was also an overwhelming theme that the amount of screen time, the pace and rigor of courses, and the challenges that come with teaching and learning and full distance learning were not sustainable at the pace that we were working at. That was probably the most overwhelming and consistent theme from folks. It was just too much, too often. You have to imagine that everything that happens in distance learning for a teacher is harder. Everything. Every lesson plan has to be redesigned. Every new technology tool has to be learned. Every assessment has to be given in some new way to make it a good assessment or a helpful assessment. Nothing is easy. So one of the things that we knew we had to create a schedule that allowed for more collaboration time for the teachers, more prep time for the teachers, and more downtime and less screen time for the students. So the second quarter academic plan that we shared with you certainly has a more, what we believe to be a sustainable model of teaching and learning that, that we believe will benefit both the students and the teachers. The second thing that we'll go through, and when we talked to Dr. Oshida and Dr. Williams, that we wanted to make sure that the return plan itself was sustainable in that we didn't have to come to campus, have the virus spread here on campus, and then be asked or forced to shut down again and go back into full distance learning. So the academic sustainability was important, so was the return to campus. So both of those pieces infused our decision-making when it came to structuring the second quarter. The next thing I would say is that that wasn't easy. All of what we did, as you can imagine, is quite difficult. There are dozens of competing concerns and interests and ideas, and it was hard. It was hard to figure out what was the best course of action to satisfy the needs and sincere desires of all the parties involved. I know you appreciate the difficulty of that task for any school, not just Jesuit high school. So when we were faced with that particular task, I and the leadership team really decided, what do we know we have to do? And what we have to do is care for people's health and safety, both their physical health and safety, but also their emotional and mental health. And that really led our decision-making as well. How do we make this sustainable for these human beings who we are in community with, that they are safe physically, emotionally, and mentally? And those are the things that really guided our work. That sustainability is necessary, but it can't work if we're pushing ourselves too far that we can't be successful anyway. Whatever it is that we're doing at Jesuit High School, it has to be done in the context of caring for one another and supporting each other's health and safety. That's the framework and the context that I wanted to talk through. And yeah, this is uncharted territory. So what we're doing is never been done at Jesuit High School before, both academically and as we talk about with our safe return plan with the screening program we'll learn more about. I'm going to start before we talk about Immunify and urgent care now, talk a little bit about the academic framework and how it's been structured. So the first thing we knew is that we couldn't begin to return to campus with the full student body of over 1,000 students. We just didn't feel that we were prepared for that or that we could be successful in that return with that many students. We do think at some point we'll be able to return to that plan, but we had to start with a phased approach. This is why the red and the gold divisions of the students were created, so half the campus will return. This will allow for more manageable return, a safer return, and allow us to reintegrate at a pace that our faculty and our staff and our students and our parents can adjust to. We know that that red and gold division is not helpful for some folks, and I empathize and I'm sorry. That's a tricky part of the bureaucracy here. The challenge is that the divisions are designed to keep the courses split evenly. Otherwise, we'll have classes of 22 or 23 and classes of 1, and that can't happen. So we had to be very strict in that division, and we can't be moving students really between the red and gold. Otherwise, it messes up the entire plan. So as you see in this schedule, the red group will attend classes on Mondays and Tuesdays, and the gold group attends classes on Thursdays and Fridays. While they're not attending class in person, they're attending classes remotely from home. This includes students who are on a red and gold cycle, but also includes students who choose not to attend campus at all. It's perfectly fine. Any student is allowed to stay home for the balance of the semester and learn in full distance learning. That is a perfectly acceptable option for all students and families. If you're on the opposite day or red on a gold day, you'll do the same thing as all those students and learn from your home from the Zoom platform. Wednesdays, some families have said, why do people have a day off? And I want to talk about Wednesdays. They're not a day off. One of the things we've learned in distance learning, both in the fourth quarter last year and the first quarter, is what we lack is something that we haven't really noticed before because it's been so prevalent in schools. A lot of the learning in the classroom experience takes place outside of the classroom. It's wandering by a teacher in the hall. It's staying after class for a moment to talk about something specific. It's seeing teachers on lunch duty or yard duty and connecting. It's seeing your friends in the hall and clarifying assignments. So the class time is really important and critical, but it's the intermediate time that is as important to enhancing the classroom experience. So what Wednesday has been designed to do is help to replace some of that informal navigation of the curriculum through formal office hours with teachers, with collaboration sessions, so that we can get those questions answered throughout that Wednesday, and then time to do work and time to get off the screen and relax, which wasn't taking place in the previous model. We really want students to use the Wednesdays to engage with their peers, engage with their teachers, and continue working on their class. We don't consider that to be a day off. And then the next thing that I want to talk about is the training week. We are embarking on, as I said, an uncharted adventure to return students to campus amid COVID-19. There's lots of regulations and rules and practices, and I think they're going to be really helpful and good, but we have to teach the students this. We tell new teachers in the area of classroom management that procedures aren't told, they're taught. You have to review over and over again and train on what we expect folks to do. We have to give them a chance to learn this before we throw them back onto campus and not have them understand what's happening. So that week is meant for training. It's also meant for our teachers who now have to learn how to teach in a hybrid model. We trained on this over the summer. They're ready for this, but this will be the first time our teachers have ever taught to an in-person and a stay-at-home audience in their careers. We want them to get prepared with the technology, the pedagogy, the assessment, and the skills they're going to need to be successful in that environment. So next week's training is not just for student orientations to this new program, it's also for our faculty to prepare with their colleagues to be successful in the hybrid model. So we thank you for that, and we have to reiterate that training is going to be critical. We have to have the students attend that training if their desire is to come back to campus and navigate campus within our safe return plan. So we can't waver on the importance of attending the training sessions next week. There will be at some point a makeup training session for folks who can't make it. We don't know when that is yet. We have a lot to learn still, but we will try and make that happen. So if you couldn't attend that session, you can't return to in-person learning right away, we'll find avenues for folks to go through that training, possibly a weekend, so that we can then get them back on campus after they experience that. You also see built into the schedule time for a robust weekly screening program. And this is where I'll start transitioning over to Dr. Oshita and Dr. Williams. The schedule allows for us to screen for COVID using antigen testing the cohort of students returning to campus for that particular 2-day cycle. So the red group will do a screening on that Monday morning, and the gold group will do a screening on that Thursday morning. What we accomplish with this is we're able to, and I'll let obviously the doctors say more about this than I should be able to say, but it gives us a chance to identify virus, live virus, active virus that can be contagious prior to the students exposing other students while they're on campus. This provides a layer of safety for their fellow students, for the faculty and staff, and for the Jesuit community who live on this campus every single day. So the purpose of that is to make it safe while they're on campus and to sustain our ability to stay open as long as possible. Should there be a spike in COVID, we hope we can navigate that challenge by being the safest place around for the return to school. We do fear, and we do, I think, appropriately have concerns that schools may be forced to close if the virus reemerges in their communities. Then we're back kind of to square one. And if we can avoid that as much as possible, we want to make sure that happens. So we do acknowledge this is a pioneering program. This is a new venture for all folks. Everyone who's trying to do this is paving their own path. And that comes with its own anxieties, as we can imagine. Of course, we should be nervous about this. We wouldn't be human if we weren't nervous about this. But we also think that what we're putting together is a plan that satisfies our need to take care of everyone's health and safety, physically, emotionally, mentally. So with that, I'd like to introduce Dr. Oshida and Dr. Williams, and they can talk about their background and how they got involved in this process of antigen testing and their proximity to COVID from the very early days. So I'll let them introduce themselves. Go ahead.
Great, thanks, Dr. Wood. I'll start off. My name is Rusty Oshida. As Father McGarry said, I do have a very proud, we're very proud of our boy, Sam, who is a senior at Jesuit, and we're very excited. It does make it also a very vested interest for me from a parent level that Sam is going to be entering onto a campus and in-person teaching and an in-person interaction with his friends, colleagues, etc., in a very safe manner. I wear another hat, and that is the hat of an emergency physician. Dr. Williams and myself actually work at the same hospital. Our hospital is the North Bay Medical Center, and we carry the dubious distinction of diagnosing the first patient in the country with community-acquired COVID. So no direct travel to China or some other hotspot, but that was the very first patient in the entire country that had community-acquired COVID, and we diagnosed that patient. So what that means is that we've been on the tip of the spear here since very, very early this year. We've had the CDC, California Department of Public Health, Solano Department of Health on our campuses, and we've been actively involved in watching the changes that have happened over the times. In addition to my role as an emergency physician, I own 2 urgent cares in the Sacramento area. One is right down the street from Jesuit, and that certainly makes a natural sort of a help that's certainly by proximity that makes it efficient and nice. We, since early on in this disease process, have seen thousands of patients at our clinics for concerns of COVID. And so we certainly have the means and access to help there. Most recently, I've been involved in a number of research studies. Currently, I am the principal investigator for Regeneron monoclonal antibody use. It's getting quite a bit of press. I've received a number of text messages on my drive home from the emergency department today. Apparently, Donald Trump has said this is going to be in the water and free. I haven't quite reached that yet from my perspective. But I'm also participating as a sub-investigator in the Moderna study for a vaccine for COVID-19. So I have a very, very strong interest of getting our boys back to school in a very, very safe manner. One thing that I will piggyback off of Dr. Wood, and that is that what we have learned thus far, and we hope to give you more information tonight, is that this is a multimodal approach. There is no single model that is going to work, that has not worked through one country to another country, and it certainly has not persisted from one school, one county, et cetera. And I think you're going to learn some of that approach tonight about our most multimodal approach. So, Dr. Williams?
Yeah, thank you so much, Rusty. My name is Ben Williams. I'm also an emergency doctor. I'm a father of 3, also a graduate of a Jesuit education in Arizona. I also have a background in public health. Like Rusty said, we did see the first case, of community transferred COVID in our hospital. And I started seeing, at that time, a lot of primary health outcomes from COVID. So bad, very sick individuals. We also started seeing a lot of the secondary effects from when we closed the state. We had the isolation and no one was kind of working, we saw. In ER, we saw a lot of people losing their jobs, losing insurance. And it was a very frustrating experience as an ER doctor to see very sick people and then to see other people who were not getting care because they weren't able to because their clinics weren't open or they couldn't get their prescription filled. And we also saw people that wouldn't come to the ER because they were afraid to get sick and just delaying these diagnoses. And it was a very frustrating experience. And I mean, as an ER doctor, we're very used to creating our own solutions. And what I saw was a frustrating experience. And I thought to myself, we should do something. We should create an app. I mean, we can do testing. Testing, isn't necessarily that hard, but we should put the app and testing together and truly create something that kind of enables people to go back to normal. And when I say normal, I mean, the real way to get back to normal is, like Dr. Wood referenced, is the majority of transmission of infection is prior to symptoms. 1.8 days prior to symptoms, people are actually very infectious. And so we need to identify people before they have symptoms. We can't just do a symptom tracker and temp checks at the door, because the reality is if you use that model, you will miss the majority of people, right? The CDC just kind of put out that over 60% of infections occur prior to symptoms. And so again, we really need to identify people before they or before they have symptoms to mitigate risk. And that's the whole goal of Immunify, is to minimize transmission and to enable people to reintegrate responsibly. We want people to be able to make informed decisions by sharing their data with whomever the user chooses, not us. I don't share your information. I don't give anyone's information to anyone. This is a free app also. This is not a monetarily driven product. And again, it came from our background, or my background in public health, was this is a terrible thing that we are all facing, and we needed to create something that was creative. There is no centralized app where people can upload their results, as well as their symptoms, as well as high-risk contact questions, and put it all together, generate a risk, and then say, hey, should I interact with Rusty? Is it worth that risk going to dinner, even if we wear masks, if we socially distance, and we do everything that we can from a best practice point of view? Is it worth it? Like I said, I have 3 kids. Is it worth it for my kids to go back to school? If we're not going to be doing testing on a regular basis, in my opinion, I feel strongly as a parent that I don't want my children going back unless they are doing repeat testing. Because again, we can't identify the dangerous people. The majority of infections, again, happen prior to symptoms. And so that's really why we created the app. And I created the app with a bunch of other doctors. We hired a company to code it. And we had a third-party company verify it. We've crashed servers. We've tried all these different things to make sure that it's appropriately secured. We use servers only in America. They're located in Silicon Valley. It's run by Amazon. Our servers are also HITRUST certified. We store, the user's name and phone number, and then the results of their tests. So, positive, negative, and that's pretty much it. There's no storage of, credit card information, health information. Health insurance information. That is kind of a separate thing. This is, like Dr. Wood also said, a pilot program where, and the reason, I don't know if you've tried to Google us, we don't really have a website per se, because we do most of our work without needing a website. We contract with other businesses, and we do things like paper printouts. And again, from my point of view, printing out a lab test without having a symptom tracker and contact question is also not great, because again, what happens if you get symptomatic a day later from your test? It makes it very difficult to create something that encompasses, like everyone has said already, all the potential risks that exist. And what we're doing is we're trying to create something that enables every student to go back to school, right? That's our goal. Our goal is, I don't want to focus on bars and tattoo parlors. That's not where we talk, right? We talk to, right now we're talking mostly to schools, and we're trying to create this system for safe reintegration. And we try partnering with other large companies who do labs, so like RT-PCR, and getting them to use our system and make patches so they can upload seamlessly. That's currently where we're focused, as a business, and in the direction that we're heading. So like the workflow, really is on the day of, like Dr. was saying, on Monday, will be the first time where we do swabbing on site. And Rusty and his team of medical professionals who are well trained and how to do that will acquire the specimen. The specimen will be processed on site. Results will be posted pretty much immediately. It takes about 14 minutes from swabbing someone's nose into the machine to run it and then get results. The results are then posted pretty almost instantaneously to the server. Then the server uploads it into the app, and the individual can share that information with Dr. Wood and his staff at the front door. And then every day, the students are going to be prompted to do symptoms, again, to make sure they haven't developed a fever or runny nose or, whatever, any other viral symptom. as well as high-risk contacts, and that contextualizes, again, their labs. And so that's what we're trying, to create, is the safest environment for all children, all students, really. And so I will turn it kind of back over to Dr. Wood, and we are, here to answer any questions. Both Rusty and I are definitely available, post this conversation also to discuss this.
And Dr. Williams, I will bring one question to you that's relevant to something you shared just a minute ago. It's one of our questions that came from one of our families. They're wondering how the Immunify app is different from what others are familiar with that are a COVID tracking app that, I think if you could discuss that and also distinguish that from whether or not the app does any tracking of a student's movements when he's off campus, please.
Correct. So, no, the app does not do any contact tracing. We don't follow the app. We don't report where the phone has been. We don't kind of release any of those information to anyone. That is not generally a thing that Americans are pro. So that's definitely not something that we do in our app. I'm sorry, I answered the contact question, but I might have forgot the first part. I apologize.
It was, you actually did hit on it. It was the issue of privacy in terms of a student's movements off campus.
Correct, and that's not something we do. The contact tracing we leave to Sacramento County Public Health, and that's not what our app does. Yeah.
Great, thank you.
So the first thing that I would ask you guys to answer for us would be, people tend to want to know about the actual test itself. They've seen the very invasive test that had been used before, and like you talk about this test and how it's quite a bit different and not invasive.
Sure, I can answer that, Ben. Yeah, so it's we heard this quite a bit, and as mentioned, Ben and I have been at the beginning of this, where the testing was actually much more invasive. The answer is this. So the test that you'd heard about before is called a nasal pharyngeal swab. It effectively takes a self-contained swab like this, and I'll use my pencil just so you can see it a little bit easier, and then through the nose comes up into this nasal pharyngeal passage. We refer to that as the brain biopsy. We are no longer doing brain biopsies. We now refer it to the picking the nose sample, and effectively less than 3/4 of an inch of the swab comes up 3 circles each nair and goes into the machine. And so we do always look to make sure there's no deviated septum, no bleeding, anything like that. Thus far, over thousands of swabs that we've done in this fashion, I have not seen any nosebleeds, other things like that.
Can you talk a little bit about the type of test that we're doing, the antigen test, and the corporation that makes this test? Yeah.
Sure. Yeah, it's there's a lot of discussion about test accuracy, sensitivity, specificity, and these types of things. For brevity, I'm going to break it down into this fashion. There's an RT-PCR test. RT-PCR looks at the actual RNA backbone of the virus, and it's looking for specific pieces on that. This is a highly sensitive test, which means there is a possibility for a false positive. A false positive meaning individual has no symptoms 90 days after having disease, but could still test positive. The next test for the nasal swab is called an antigen test, and you've heard Dr. Wood mention that today. The antigen test is looking for that active virus. So effectively, if you have antigen positive swab, you have active virus. And we are using that active swab because what we're looking for is not so much that high sensitivity, but as Ben has mentioned, we want to find that person that may not have manifested symptoms because they are pre-symptomatic, so not having symptoms, but they have disease that could infect those around them, or they're asymptomatic, they're not having any symptoms, however, they have that live disease and can infect those around them.
I'll note, and it was mentioned before, but it's worth repeating that this particular process does not negate the need for the school to do its other serious virus mitigation processes with smaller class sizes, physical distancing, plastic shielding around desks and teachers' desks, and all the other things that we have in place. So this is just one other layer of protection that, as Dr. Oshita said, helps us to identify those pre-symptomatic cases before they walk onto our campus or walk through our campus and attend classes. So,
Dr. Oshita, could you add to your response, if someone has already had the virus in the past, does that interfere with the testing? Does it detect antibodies? Is the question that we got in the chat.
No, an antibody test is a blood test. And there are two different types of antibodies. IgM antibodies for the acute phase. So if somebody just contracted disease or recently contracted disease, these IgM antibodies will rise positive and then wane within the first couple of weeks. IgG antibodies are the so-called immunity antibodies. These are still yet to be fleshed out as to whether we can determine if somebody is IgG positive and it confers immunity. So we are not doing blood tests, we are doing nasal swabs for active infection. The testing platform that we use is the Quidel company. The Sophia 2 analyzer is the specific machine, has a 96.7% sensitivity.
the next question we should talk through is the funding. If you can talk a little bit about the larger picture funding, I might be able to hop on at the end there and talk a little bit about the mechanics of that at Jesuit High School.
Sure, yeah. So the funding, like I said, so we at our urgent cares and in the ER and what have you, I guess the combination of this, we've tested thousands and thousands, probably tens of thousands, or definitely tens of thousands of individuals. The testing is covered by what's called the CARES Act. The CARES Act is a federal government. The federal government does require that, and so it pays for everything. So there's no copay, there's no balance up or anything like that to individuals. The CARES Act does have a caveat that we do have to put that through one's insurance just to verify that that insurance is active, valid, what have you. At our clinics, we are a designated HRAS site. So if somebody does not have insurance, as long as you have a government issued ID and a social security card, we can bill that through a parallel program with the CARES Act.
What that means for us, and again, this will be shared out on Friday in our message that we want everyone to keep reading, please. They're staying connected message. We're going to ask folks to update in their final form some acknowledgements and waivers as part of this process. One of those things that we will be asking for is that we'll need families to either allow us to use the health information that we already have on file that you've already shared with us through final forms, or to provide new information or updated information for us to use as we begin this process during those trainings. One of the reasons we have to do that is because that is the way that this CARES money is facilitated, is through private insurance, but it is no cost to the families for this process, no copay and no charge on the back end, but we do have to facilitate it through the private insurance. Sorry, Dean Theodule or Dr. Desmond, any other questions you're seeing in there at the same that we should answer live right now?
We're covering the live questions, so we're yes, we're
Okay.
doing okay right now. So if you're,
Okay.
you're welcome to continue. We'll keep interjecting as they come up. Relevant.
Got it. So one of the questions that comes up is what happens if someone tests positive. So they're on campus, they go through and they have their nasal swab, and they're waiting in what will be a waiting area that will have students waiting for their app to update with hopefully what is a negative test result. And then they'll move on to campus and go about their day. But at some point, someone's going to test positive. We can talk a little bit about what happens next would be helpful.
Sure. So after the user was swabbed and swab was processed, and the swab is then uploaded, the upload process will notify the individual's phone, and it will just ping, you know, and if you've enabled push notifications, then you'll get a little chime or whatever noise you have associated with that. Then it would give you instructions on your app about what to do. We wouldn't, you know, call out across the, you know, football stadium, you know, that John has COVID. We would keep it very discreet. The app would then direct you on your next steps. The current next steps are, again, from my opinion as an ER doctor, this is not exactly the most clear area, but if an antigen test is positive, we should still get a confirmatory RT-PCR. That is currently what Sac County is saying. Some people are also saying that you don't necessarily need it because the accuracy of the test is so high that a positive antigen test means positive disease. But again, we're trying to create the least opportunity for risk and the least opportunity for missing individuals or for misclassification of an individual as positive infection when they don't have it. Most of you probably saw that the Ohio governor had a positive test result 3 weeks ago, and it turned out to be a false positive. I mean, this is a very contentious issue, but I mean, right now we are currently recommending RT-PCR testing to further confirm the antigen test, and it will direct you on the app how to do that and then how to re-enter the algorithm, how to get the student back to campus safely.
We also have on campus, so what the Jesuit high school side of this is that we have a on-campus medical professional, an RN licensed in New York and California, and maybe Connecticut too, I can't remember. And she'll be helping us navigate all the nuances of what would happen if there's a positive case, working with the families to sort through the details of getting the confirmation and that return to campus process. We also have, as a part of that, a dedicated space on campus where she works, which if there are symptomatic students on campus, they will be directed directly to her office so she can do an assessment and guide that student as needed. One of the questions that's coming up in here, and I think we should address it, and I'll try it a little bit, and maybe Dr. Oshida or Dr. Williams might need to jump in, is how long will we be doing this testing for? It's a fair question. And I think when we're in COVID and planning for things, in my opinion, I've stopped answering questions about how long will something last for, because things just change so quickly. And so I think there's a lot of things that will change, that might change between now and the end of the semester, for example, right? There might be new data that points in a different direction. There might be new tests out there that are cheaper, more efficient, or even faster. There might be changes in the government funding. There might be any number of things that will adjust our need require that we adjust and change our plans. So we're going to commit to this process right now through the semester. It might even change within the semester, but we need to make sure that we are adaptable should any of those outside factors that are outside of our control change and make it prudent for us to go a different path. Is that fair to say, doctors?
Yeah, I think just one other piece to add to that is we know that there are a number of touchstones, if you will, that change the direction of surveillance here. And that is, as we progress through these different stages and phases, color coding, schemas that we have in the state, we are worried about prevalence of disease. So how much disease is potentially out there. And so that makes that vigilance of a multimodal approach, making sure that we're doing the physical distancing, masking, hand hygiene, also active tracking for contacts, active symptom tracking, and active testing. And so depending on disease prevalence is potentially one other factor that weighs into the scope of the practice here.
And I'll chime in real quick too on that question, Dr. Wood. No one really can say, when this will end. We're all kind of waiting, hoping, right, for a vaccine. I mean, we got some bad news last couple of weeks, right, with the vaccines being put off past election, right, possibly at the very end of 2020, likely more in 2021, first quarter. I think, we've all seen also that it would take a long time to ramp up production, and then to vaccinate 70% of Americans is going to take some time. We also are now realizing, right, that the leading candidate needs another booster, right, 2 shots. And so our compliance is going to be difficult from vaccination point of view. And this is also under the assumption that the vaccine is 100% effective. If the vaccine is 60% effective, which would be still very good, that's generally about what the flu vaccine is, that still means that a lot of individuals would still get sick. Also, it would likely need that if, we would need another flu shot every year. And we would still need to be able to track if you've had the vaccine or not, which is another option for the app to check. And if you've had a vaccine, we can incorporate that, and we can incorporate titers, and we can still create safe environments. But like Dr. Wood said, everything is changing so fast that no one can predict when this will actually end, unfortunately. And like I said, I would love for this to end, but no one knows when that day will be.
So, Dr. Desmond, Dean Theodule, anything else that we can answer on there right now?
So a lot of the
There's
questions,
lots of questions coming in, so it's hard for us to sort through them. So be patient with us, please.
yeah, and I'm trying to save the questions that I know are going to be communicated on Friday for the Friday communication. Those answers and staying connected are coming. So right now, if you have other things to cover, Dr. Wood, you can continue.
Sure. One of the things I want to note is that there are dozens of logistical details on the mechanisms of how we bring the students to campus for this training week #1, and then for the actual return to school. And so we are doing walkthroughs and practicing and mapping out all of the minute details of where they stand when and where they go after this. So some of those things we want to wait a little bit to finalize all the details and share them, because there's some just logistical operations we want to work through as we ramp this up. So there are some questions about that, and they're good questions, but I ask that wait till Friday and wait till we do our trainings for a lot of those particular details to be worked through. We don't want to advertise a particular pathway or a particular part of the plan that we have to redo because we found a better way. So we have that.
Dr. Wood, would you mind if I just shared real quick, why we chose once weekly testing as what we're doing? Sure. So, we chose once weekly testing from an article that was in preprint in the BMJ that was published about 2-3 weeks ago. It's the first paper really that determined antigen test frequency and how it changes the rate of transmission. Most of us are aware, that the NBA had a bubble and they were doing daily antigen tests. That's very impractical, right, for our kind of population, period, from a cost point of view, from time, from logistical issues. That's not a really realistic thing to think about testing everyone currently, once a day. But the NBA had a great success, right? They did a great job. They had very, very, very few, kind of incidences of infection. This study that I was kind of mentioning kind of looked at what would happen if we did every 3 days. Well, if we did every 3 days, we would reduce transmission by 85%. If we did it every 7 days, we would reduce transmission by 60%. If we do it every 14 days, we reduce transmission by 40%. And what we are trying to do, is to try to find the balance between testing frequency, like how much are people willing to tolerate, how much is also, kind of reimbursable through the government currently, and then try to figure out how do we incorporate that? What do we do in the meantime? On those other days in which we're not testing, how do we make sure that people aren't getting sick? And again, that's how we chose the once a week, because it still has a over 50% reduction in transmission. And it was easy to couple with students because they're at school 5 days a week. And we could kind of create a way for students to get tested regularly and then use the weekend as the time for them to kind of stay home. If they develop symptoms, they can isolate prior to returning to school. Again, so to kind of keep everyone off campus that is infectious. And so that's why we chose the numbers that we chose.
There's a question, thank you for that clarification. There's a question that asks, will faculty and staff be tested? Yes, the answer is yes. The only way this works is if everyone who's coming to campus and engaging and congregating in indoor spaces, which is what school will be, which obviously has its own level of risk. That's why schools are one of the later things to reopen. That yes, the faculty and staff should definitely also be tested. They'll be tested using the same process, but we will put them on a different part of campus. So they'll test more to the administrative side of the campus, where the students will be down below. So just to clarify that particular question.
Dr. Wood, there are a series of questions, again, that are going back to the insurance part side of things. So I want our families to recognize that I know we talked about it a little bit, and we'll make sure that that's, again, part of written communications that are going out.
Right, those are the nuances I don't would be unable to cover right here in the last few minutes of the webinar, but thank you for noting that, Fadia. There was another question maybe that we could answer live. Again, remember, to all the folks who came late, if you're asking questions, we are taking note of all of them, and we'll be answering them in our communications on Friday and in a growing frequently asked question sheet to go through all of this. And then there's a school, there is a question about how many other schools are doing this type of testing right now. And there aren't many, we haven't found many, if any, in our area right now who are doing this. They are looking at it now. They are inquiring as if this is going to be a product that, whether through Immunify or other particular avenues, that they can explore. And I'm open to saying, I think it's appropriate to say that Jesuit is certainly on the pioneering end of this, right? We know that we are doing this to increase safety, to give us the best chance of staying open. And like anything right now, we are delving into something we've never done before. We didn't want that to deter us from trying, right? We didn't think that there would be harm in trying this. We don't believe there's harm in trying this. The benefit of us doing this, we believe, will both make Jesuit safer and better, and hopefully for a longer period of time, but also maybe other schools learn from what we're doing, both the things that we do really well in that work and things that we may need to do differently as we adjust. That if we can be a source of knowledge and of guidance as leaders of schools reopening, then we feel that we have the opportunity, we should do this and help out all schools.
And I would just second that. I know that I'm not affiliated with Jesuit, but I mean, Jesuit is going above and beyond from what Dr. Wood has been doing in terms of organizing the classrooms, in terms of the cohorting. The strategy that has been put behind your reopening plan is excellent. You are definitely, exceeding the standard with coupling it with testing. And so again, this is, again, in our opinion, I think in most people's opinion, would be the most safe environment that exists or currently exists. And so we thank you for the opportunity, Dr. Wood, to help and to create this environment with you.
Dr. Oshido or Dr. Williams, there's a question here about the app specifically and parents' ability to receive notification about their son's screening status.
Yeah, so the way in which we would recommend doing that, because the students are generally minors, would be as using one email address and then having the same password for both individuals. We can't create multiple profiles within the app, which I know is somewhat annoying, but it creates confidentiality issues if you were able to see multiple profiles and you weren't necessarily related to the individual. But what you would do is, take, say, mom or dad's email address and then use that same email address and then know the password and share it with your son. And then the mom or dad could log on to that email address on the phone and then see what the test results are, if your son has been doing his symptom tracker contact questions. And so there's ways to do it in that way. That's how I would recommend doing it currently.
There was a question, do students need to use their Jesuit emails from last night? And the answer is no. There's no need for you to choose a Jesuit approved email address. You can certainly use the parent and family email. And another important note was that no health information is emailed to the email that you put in there. So that would be obviously a problem for security.
And in regards to security, we're actually we're going to work on turning on biometric. So just like when you open your Chase app, it looks at your face or your thumbprint. The Immunify app can be coded to do that as well. So that's another thing we do. We also do two-factor authentication. So when someone else logs into your account, you receive a text message to the phone number associated with it. Again, that gives another layer of protection. So we try to create, again, the safest possible area also for the information that we are storing.
There's a few questions on there with athletics. They're good questions. We'll answer those in the FAQ at the end of the week because it's an important part of it is that their co-curricular activities will play a role in this. This testing program also covers them, right? So if they're coming to their games and practices, if we have games at some point here, their weekly test would allow them to keep participating in that. there are certainly lots of high schools athletic programs, so we're looking to see how they might incorporate a screening program so they can have their athletic seasons right now. And so that's something that we're hearing a lot in Northern California athletic directors.
And I don't think I can speak to the exact nature of which team would participate on campus or off campus, what have you. But we have been approached by a number of the other Catholic schools in Northern California. They are doing some testing. Some folks are doing some screening and bits and pieces. They don't have the full multimodal approach, but they have approached us, especially, is there a way that we can, if we are interfacing with Jesuit, that their athletes could be tested. There was a lot of concern because Jesuit is taking these very, very precautionary approaches and then putting our students, our son plays volleyball, for example, if he's blocking at the net against another school and that other individual has not been screened, has not been tested, doesn't have that contextual data, et cetera, they're at risk for that too. And so we have chatted with them, and again, I don't want to speak to Dr. Wood and what Jesuit High School is planning to do, but this is a concern across the board.
So I would just add, because I know Dr. Wood is going to bring this to a close in a few minutes. We want to be respectful of your time. I hope what we are revealing to you this evening in this webinar is that we are doing what we always say we are doing through the mission of Jesuit High School, and that is to reach for the magis, that Latin word that means more. We are going the extra mile. We are doing more to protect your sons through this testing program that these doctors are generously providing to us. I know there are lots of questions still. The frequently asked questions document that Dr. Wood and his staff will prepare for Friday will answer your questions if they haven't been answered tonight. But I hope we can continue to have hope in the fact that we are doing everything we can to make this a safe return and also to sustain the return. I think that's been an important point tonight. We don't want to open up and bring everybody back and then have to close again. So we're being cautious, we're being prudent, but we're also being, I think, very proactive in terms of safety. And I thank you, parents, for trusting us and working with us. And I thank these two doctors here and their colleagues who are providing this opportunity for us. We will be very excited to receive the students back to the campus next week. So thank you very much.
Thank you, Father McGarry. I echo your gratitude to Doctors Oshida and Williams and your partnership with Jesuit and doing this work with us in this this new normal, I guess, that we're living in right now. So thank you for that. Thank you, Dr. Desmond and Dean Theodule, for your work with the questions and keeping us on track. And Elizabeth Sands for your great work in marketing and communications. And most important, thank you to the parents who trust their sons to Jesuit, who believe in us, who are patient with us, and who partner with us to do the best we can to educate your son. So it is past the hour now, so we are going to say goodnight, but have a great evening and God bless.
Thank you, everyone. God bless you and your families. Thank you, Dr. Williams, Dr. Oshida.
Thank you very much, you guys.
Thank you, everyone.
Thank you.
All right, Elizabeth, does it automatically give you the questions?
Yeah, I made sure I double copied and pasted.
Got it, okay.
Oh, I got the last of those
All right, well, I'm gonna hop off.
Good, I got them all.
All right, thank you so much. Good night, everybody.
Night,
Good night.
guys.